Part of building healthy relationships is to use assertive communication to establish healthy boundaries for behavior. Whether dealing with a family member, friend, or a new acquaintance, it is important to ensure that your needs are being met and that any unwanted behavior is quickly put in check. Harassment is persistent and intentional behavior that can come in the form of bullying, teasing, or any other unwanted attention that is meant to be annoying. There are a few simple things you can do in order to avoid being harassed or coerced in a relationship. Pay attention to your feelings and instincts. Staying in touch with your feelings will allow you to better define what you need to feel happy and satisfied in your relationships. With this knowledge, you can decide which personal boundaries are necessary to protect yourself and maintain healthy relationships. Once you have established clear personal boundaries for yourself, the next step is asserting those boundaries in your interactions with others. Since you are the only person who knows what your needs and desires are, it is your responsibility to communicate those needs and desires to the people around you. It is unrealistic to expect other people to know what you want and do not want without assertive communication. If someone is behaving in a way that makes you uncomfortable, you must use your communication and refusal skills to make it clear that you do not want the person to continue acting in that manner. Remember to keep your communication polite, however firm and clear, to avoid any confusion on the part of your harasser. A well-constructed I statement is generally pretty effective. For example, if someone has repeatedly been asking you for a date and you do not want to date that person, you could respond with, "I feel uncomfortable when you repeatedly ask me for a date. I need you to respect me when I say no thank you." It is important when asserting personal boundaries to use strong body language. Stand up straight and maintain good eye contact. Speak clearly and use a voice that is strong and firm, but be mindful that in most cases, shouting is unnecessary. Sometimes speaking up for yourself can be extremely difficult. Advocating for yourself can be scary if you are shy or lack self-confidence, if you worry about hurting other people's feelings, or if you are dealing with peer pressure. Your peers include those individuals who are similar in age, experience, or who have similar interests to you. Peer pressure can be a positive influence, for example, when your peers offer inspiration, support, encouragement, or even a little friendly competition. However, there is a dark side to peer pressure that can cause stress and anxiety or make you feel compelled to do something you are not comfortable doing. Especially during adolescence, peer pressure can be difficult to resist since most people have a strong desire to be accepted by their peers. At some point in life, nearly everyone deals with peer pressure and the necessity to make a decision that could be viewed as unpopular. Think of these situations as opportunities to figure out what is right for you and to practice self-reliance. It can be very difficult to figure out how to say no without losing friends, but saying no is an important skill to have. Here are some tips that can help you stand up to peer pressure. Pay attention to your feelings and instincts. If your gut is telling you the situation isn't right for you, listen. Part of developing good decision-making skills is learning what makes you happy and what doesn't. Plan for situations where you might experience pressure from your peers. If you are going to attend a party, for example, decide ahead of time what you want to do with regard to alcohol, drugs, or sex. You can rehearse what you will say and do in a safe space, so you are well practiced before you enter a potentially difficult scenario. With friends, you should never have to apologize or explain the decisions you make for yourself. But if you do feel the need to make an excuse, it is helpful to think in advance what you will say. Choose friends that will support you when you are facing peer pressure, and be that kind of friend as well. Chances are that if something is making you feel uncomfortable, others feel that way too. By speaking up, you give others the opportunity to voice their feelings as well. Having just one other person support you makes it much easier to resist peer pressure. A healthy relationship creates a safe space where you can be yourself, pursue your independent interests, and explore new opportunities with the trust, support, and encouragement of your counterpart. Healthy relationships do not involve jealousy, possessiveness, harassment, or coercion, and there is no room for violence in a healthy relationship. One of the most serious consequences of relationship violence is rape. Consensual sex occurs when two people agree to have sex with one another. Rape is non-consensual sex. Rape occurs when one person forces another to have sex when they have said no, when one person coerces another into having sex when they don't want to, or when one person has sex with another who is incapable of giving their consent, either because they are too young or because they are impaired by alcohol or drugs. Rape is never the victim's fault, regardless of what they were wearing, where they were, whether they consumed drugs or alcohol, or whether they were behaving in a provocative manner. A person who has sex without their partner's consent is committing rape, and is the only person responsible for that crime. It is important to note that an individual always has the right to say no to sex, even if they have had sex before, even if they have participated in other sexual activities, even if they have started having sex and then changed their mind, even if they are in a committed relationship like a marriage. No one is ever entitled to sex, regardless of whether they have paid for dinner, drinks, a movie, or whether they have signed a marriage document. It is always necessary to receive consent from a partner before engaging in sexual relations. No means no, and the absence of a no does not mean yes. When seeking sexual consent, it is important to pay attention to body language just as much as verbal language. Body language can be subtle, so in order to avoid any confusion when it comes to sexual consent, it's a good idea to check in with your partner to make sure they are comfortable with your activities. Rape is unfortunately more common than you might think. According to the Rape Crisis Center, 1 in 6 American women and 1 in 33 American men are the victim of an attempted or completed rape. In the majority of cases, a rapist is someone the victim knows and even trusts. Acquaintance rape, also known as date rape, occurs when the rapist is a friend, family member, classmate, coworker, or other acquaintance of the victim. Statistics show that overall, 75 to 80% of rape victims know their attacker. Acquaintance rape is even higher amongst children and teenagers, where 85 to 93% of victims know their attacker. In the minority of rape cases, the attacker is a stranger who looks for an unsuspecting person and finds a way to be alone with them. Rape is a crime, regardless of whether the victim knows the rapist or not. Rape is never the victim's fault. However, there are some steps that can be taken in social settings to reduce the risk of acquaintance rape. First, trust your own instincts and feelings. If you are uncomfortable with a person or situation, leave. Remove yourself from the company of the person or that situation. Second, set firm personal boundaries with others. It's your body, and you get to decide what happens to it. If someone is trying to coerce you into doing something you don't want to do, or if you don't like the way someone else is touching you, speaking to you or about you, or behaving towards you, it is your responsibility to let them know that what they are doing is offensive. Be assertive in your communication and use strong body language so the individual knows you are serious about enforcing your boundaries. Anyone who truly cares about you will respect your boundaries and will not try to coerce you into compromising on them. Finally, avoid placing yourself in a vulnerable state. Being alone, dependent, and/or impaired makes a person more vulnerable to attack. Therefore, rely on the safety net of a friend group, and avoid being alone with a person or group you don't know well. If you intend to party, make sure you designate a sober friend to handle driving responsibilities and to check in with you to make sure you're okay. The risk of being raped grows when alcohol and drugs are involved. According to the U.S. Department of Health's Office on Women's Health, nearly 11 million women in the United States have been raped while drunk, drugged, or high. Consuming alcohol and/or drugs compromises your ability to make good choices, and can also leave you physically impaired to the point where you are unable to command your own actions. Especially when you are with a person or group you don't know well, it is wise to safeguard your body by abstaining from excessive alcohol consumption and from drug use. That being said, even if you have made the choice to abstain, sometimes people give drugs or alcohol to others without their knowledge. In order to avoid consuming drugs or alcohol accidentally, do not leave your drink unattended during a social event. Consider bringing your own drinks to a party. If someone wants to make or buy you a drink, go with them to watch your drink being poured. Do not drink from a beverage that has been passed around, or share drinks with others. Do not drink from an open source like a punch bowl, since it may have been spiked with alcohol or drugs without your knowledge. Do not consume a drink if there is a strange taste or appearance, although be aware that many date rape drugs do not have a taste, odor, or color, and are therefore very difficult to detect. Discard a drink if you are uncertain about whether it might be contaminated. If you start to feel too drunk, or if you are feeling strange, seek help from a person you trust immediately and ask them to help you get to a safe place. If you are at a party or club, check in with your friends often and ask them to look out for you too. If a friend seems too drunk or is acting out of character, help them get to a safe place. Ask your friends to do the same for you. If you think you or someone else has been drugged, call 911 or go to a hospital emergency room. A doctor or nurse can help you determine what happened and can offer any necessary treatment. So-called date rape drugs include any drug or alcohol that a person uses to make rape or sexual assault easier. Any type of drug could be used in acquaintance rape, including marijuana, cocaine, prescription or over-the-counter tranquilizers, sleep aids, or antidepressants. The goal of the rapist in administering the drug is to help them overpower their victim and to prevent their victim from remembering the assault. The most common acquaintance rape drug is alcohol, used alone or together with flunitrazepam or Rohypnol, gamma-hydroxybutyric acid or GHB, or ketamine. Many of these drugs are difficult to detect if they have been added to food or drink because they often have no color, odor, or taste. Common effects of these drugs include decreased inhibitions, dizziness, sleepiness, confusion, memory loss, paralysis, and unconsciousness. Alcohol can make the effects of these drugs more powerful. One drug in particular has become famous as the date rape drug. Rohypnol is also known on the street as Rufinol, Roofies, Roche, La Rocha, or the Forget Pill. The chemical name is flunitrazepam. Rohypnol is a hypnotic sedative that is odorless and colorless and dissolves quickly into liquids. These characteristics make it very easy for someone to mix Rohypnol into your drink without your knowledge. If you ingest Rohypnol, you may forget most of the details of the events following. You may wake up unsure if you had sex or not. If you wake up with your clothes on wrong, torn, or unusually stained, if you are naked and don't remember taking your clothes off, if you have unexpected bruises, cuts, pain, or bleeding, or if your body feels like you had sex but you don't remember it, you may have been drugged and assaulted. If you have been the victim of a sexual assault or rape, or if you think you might have been, it is important to seek immediate medical attention. Call 911 or have a person you trust bring you to a hospital emergency room. A qualified health professional will be able to collect evidence of the assault from your body. Though it may be difficult, do not urinate, shower, bathe, wash hands, brush teeth or hair, or change clothes before going to the hospital. However, even if you have done these things, you should still go to the hospital to receive treatment, since there may still be evidence of the assault. Ask that a urine sample be tested for date rape drugs. Ask for a sexual assault forensic exam or rape kit to be administered. The Violence Against Women Act requires that hospitals provide these exams to victims free of charge. Going to the hospital and having an examination does not mean that you have to report the crime to police or press charges against the rapist. However, it will ensure that you receive the help you need following an attack, including treatment for injuries, emergency contraception, preventative treatment for sexually transmitted infections, as well as counseling. Furthermore, should you choose to report the crime later, you can rest assured that the evidence has been preserved. It is natural to feel shame, guilt, fear, or shock following a sexual assault. It is important to remember that in rape scenarios, the victim is never at fault, and there are people and services available to help. The National Sexual Assault Hotline can be reached at 1-800-656-HOPE. Operators are available to speak in English or Spanish 24 hours a day, 7 days a week. All calls are free and confidential. Additionally, the Rape, Abuse, and Incest National Network, RAIN, also offers live chat on their website at www.rain.org. Hotline specialists and live chat operators will listen to your story and can advise you what to do. Boundaries are a healthy part of every relationship. It is critical to your well-being that you think about and establish boundaries that make you comfortable in your interactions with others. Begin by checking in with your own feelings, and then use those feelings to guide your decisions about your own personal boundaries. You cannot control the actions of others, but you can make decisions about what types of behavior you are willing to accept and which behaviors you will not tolerate. Use assertive communication and strong body language to create and maintain firm personal boundaries. Equally important to voicing your own personal boundaries is listening to and respecting the boundaries of others. These tasks are not always easy, and it may take a lot of effort and multiple attempts before you get it right. That's okay. Managing relationships is often difficult. Practice establishing personal boundaries, and it will become easier. This is important because personal boundaries are essential to building healthy relationships.